lot of people out there who don't understand how personal protective equipment works. Some personal protective equipment can be worn all day. It can be worn during an entire shift at work. It can be worn all the time. It can be reused constantly, or at least till it wears out. And then there's other personal protective equipment that is not intended to be used that way, even if you can. And it's not as effective when you don't use it properly. It's not as effective when you don't put it on properly. It's not as effective if it's not properly fitted. It's not as effective if you don't take it off properly and dispose of it properly. And during this whole COVID thing, they've been asking the public to do a facsimile of what people in the medical field and first responders do when they wear personal protective equipment to either protect their health or to protect the health of the patient, or in some cases both. So let me talk about this. What I'm speaking most about is disposable personal protective equipment. If you go to a doctor's office or you go to a hospital and they put on a face mask, if they put on eye protection like goggles or a face shield, if they put on a gown, if they put on disposable gloves, if they put on those little booties that go over your footwear, this is to keep them from getting germs on their clothing or on their skin or through an orifice like their mouth or their nose or ears or something that you might be spreading because they suspect or know that you are sick with something contagious. Maybe you're showing them the signs, maybe you're coming in for a certain kind of test, or maybe the symptoms you've described to them on the phone is giving them a reason to be prepared. It's simply a precaution so they don't get sick. You're already sick, or they suspect you're sick, so they don't care about you, okay? But they put this stuff on, they make sure it's properly fitted, and then they come into the room with you. When they leave the room, they take it off and they dispose of it. And there's a certain way to take this stuff off so that you don't take off the gloves that were to protect your hands from getting germs on there, and then you get germs on your hands, okay? Most people don't have access to this stuff. It's not illegal to buy or overly priced. Well, some of it is a little bit overly priced, but most people just don't have. It's not like there's a corner store everywhere that sells this stuff. I mean, you can buy this stuff at medical supply stores or online, but most people don't have this or have easy access to it. On top of that, most people don't know how to properly wear it, how to properly fit it, how to properly take it off. They don't know how to properly dispose of it. But at a doctor's office or at a hospital, that's what they're supposed to do. Now, the irony is, if you want to get sick, go to a doctor's office or hospital, because that's a place where you're most likely to get sick in some cases. Even though they sanitize the place constantly with some of the best chemicals, they've got a cleaning staff to do that, and they wear personal protective equipment properly, people who work there get sick all the time because they're exposed to sick people. These barriers to getting sick are not 100% effective. They simply, each layer reduces the likelihood, but it does not guarantee you will not get sick. Now, wearing a cloth mask over your face is not exactly the same as wearing a fitted surgical mask that gets used at point of use each time. When they go from one patient to another, they don't leave the gown and the mask and the face shield and the gloves and all of that on. They take it off in between. It's meant to be used point of use. It is not meant to be reused and reused and reused, but that's what we're seeing people do. During SARS, they said that the N95 masks will not keep you from getting SARS because people were running to Home Depot and buying out every N95 mask they could find. My company, which was an international company, said you are still going to China even though there's a SARS pandemic. Business as usual. And as far as I know, none of our employees came down with SARS. All right? But the whole thing was, during that pandemic, during that scare, people were told it isn't going to work. Now suddenly it works for COVID? Really? Or just a piece of cloth over your face? And the other thing is, even if you wear this thing all day, which is too much, are you taking it off and washing it daily? Most people are not. When you take it off, are you putting it inside of something that's going to keep it from coming in contact? If you take it off and throw it on your desk, congratulations, you just contaminated your desk. Look at another thing about these. Have you noticed people are not properly wearing them? They're wearing them over their mouth, not over their nose. Or they keep taking them down. They keep taking them down to rub their face, to rub their nose, their eyes, to rub their mouth, to scratch. They're scratching more. They're touching their face more, wearing these things. And if you look at some of the exemptions for wearing them, if that doesn't prove to you that these things are feel-good measures, they don't actually really work in the real world. They're simply feel-good measures, people. And you cannot ask the public to pay the expense of disposing of surgical equipment every day. Not to mention, most of the public is so stupid and so lazy, they're not going to put it on properly. They're not going to dispose of it properly. You cannot trust the general public to be responsible like that. So, in my opinion, these masks are feel-good measures. They don't work. They also negate the whole personal responsibility. Now your safety is on me? That's bullshit. My safety should be on me, and your safety should be on you. I mean, if they're worried about the stuff coming in contact with you, then have everybody wear face shields who are afraid they're going to breathe this stuff in. I don't know. Or a full face mask. I'm not sure. But even then, they're still not going to be using it properly. They're not going to be disposing of it constantly and replacing it with new stuff. So for those out there who seem to think that their stupid cloth mask they bought off of Amazon is going to save their life, it's going to make them immune until the vaccine comes out, you're lying to yourself. You're being played by our politicians. And some of these doctors out there that are saying this stuff, they're politically motivated. Because you have plenty of other people in the healthcare profession who are saying this is a bunch of bullshit. You're not wearing it right. It doesn't work. That's not the way it was ever meant to be used. And that's my main thing. All of these face coverings and these bullshit feel-good measures that people don't do anyhow. I don't know if you've noticed it, but how many block parties have you seen? Or how many cookouts and parties and get-togethers have you seen in your neighborhood? I see tons of them in my neighborhood. They were doing them when everybody was stuck at home. If the weather's nice, people are going to get together. All right? And when the weather gets cold, they're going to be throwing parties in their houses. And people are going to be exposed to each other. You want to close down the bar? That's fine. Bar's at my house. So none of these measures really work except to restrict our liberty, to restrict commerce, to deny our children a decent education, to put the public in fear, and to divide us so they can control us. These face masks and other measures are not personal protective equipment being used the way it was meant, being used effectively, being used properly, or having any real effect on saving lives. COVID-19 is here to stay. And there are people that die from things all the time, whether it be man-made like a car accident or something in nature like some sort of flesh-eating bacteria in a lake. It's unfortunate, but that's life. We take reasonable risks every day we get up and live our lives. We need to reopen this country, and we need to go back to living our lives. That is the best treatment for COVID-19, in my opinion.